Okay, right off the bat, I'm kind of refute what he said about it when it's legalized that the drug will get better. It's already legalized in 3 states, which are Vermont, Oregon, and Montana. And as we stated earlier, not everybody dies after taking the drug. After 150 people were administered the drug, only 77 actually died. So if it's already legalized, and how's it going to get better if it's legalized in all the states? Going on to my next point here, the pain, which is why people actually choose to go through with physician-assisted suicide, if they're terminally ill, it can actually be controlled in 90 to 99% of patients. The problem with that is that doctors actually do not prescribe the correct amount or the correct medications because they're actually afraid that the patients will become addicted to them. So that needs to be changed in order for the patients to actually feel more comfortable when they're sick. Just to refute that, some of the doctors have shown that research, only 0.4% of patients that are treated with morphine actually do become addicted to it. So even the most addicting drugs that are used to help you with pain are not too addicting if you take them in controlled amounts and the right amounts to actually help you recover. And he was saying that a person that's dying doesn't really have a purpose or a reason to live anymore. But if you're dead, what purpose do you have if you're dead? There's no reason to, you don't have purpose anymore. So that's kind of an unnecessary claim to make. And a lot of doctors from an article on Medical News Today actually say that if the patients are receiving good palliative care, meaning that they're getting the correct amount of doses of medicine and were being cared for regularly by the nurses, that euthanasia would be unnecessary because the patients would be comfortable enough to keep living. And also the laws that are against euthanasia are for doctors is that they don't actually have to they don't have to present the documents on why they performed the euthanasia or why they allowed it to happen. They only have to present the statistical records, meaning that if the person was depressed and they didn't want their information going out, nobody would know anything about it. So if it's illegal to kill somebody that's depressed, like to allow them to commit suicide, why aren't the records allowed to go public? That's all I have to say. Thank you.